There may be times when the nurse in charge of the patient will need to change the dressing protecting the chest tube. This video will explain when and how to safely replace the dressing on a chest tube. Chest tube dressing changes may be ordered by the physician, or you may notice the dressing isn't adhering to the patient or has become soiled. In all of these cases, a new dressing will need to be applied. First, gather your supplies. You will need a pack of 4x4s, the wide rolls of tape, petroleum gauze, a blue pad, and clean gloves. The suture removal kit will only be needed if the tube is being removed, and that is not typically done by the floor nurse, so it will not be discussed in this video. Begin by preparing the dressing. Open the 4x4s and the petroleum gauze. With the tape, create a large sheet by overlapping strips. The sheet needs to be large enough to contain the 4x4s and still have enough tape surrounding the gauze to adhere completely to the patient on all sides. Place the 4x4s in the center of the tape sheet. If it isn't large enough, as is in this example, continue to add strips of tape to the sheet until it is adequately sized. Take the petroleum gauze and wrap it around the chest tube at the entrance site. In this example, a Blake tube is in place. This is a smaller gauge chest tube, so only half of a petroleum dressing is used. For the standard, larger chest tubes, use an entire petroleum dressing. The petroleum dressing helps to seal the entrance site so as not to allow any air back into the chest. Then take the 4x4 adhesive dressing you prepared and place the 4x4s directly over the petroleum gauze. Press firmly around the entire dressing, ensuring that it has adhered well to the patient's skin on all sides. If you need to at this point, you can add additional tape to the dressing to ensure proper adhesion. It is possible that a chest tube could be accidentally pulled out as a patient moves around the room or by any number of accidents. If this ever happens, first, immediately get petroleum gauze and cover the entrance site with it, and hold firm pressure. We want to minimize the development of pneumothorax, and the petroleum gauze will act to seal the site from any air that could leak into the chest. Then, as someone else maintains the gauze, create a dressing just like we did for the dressing change, but instead of wrapping the tube with the petroleum dressing, the 4x4s will cover the large wad of petroleum gauze that now covers the site. Contact the physician immediately, or if the patient is in distress, call a rapid response. It is wise to always keep the supplies at the bedside to do a dressing change. If there is an emergent situation, the time saved by not having to run for supplies could be what saves this patient from a pneumothorax or worse.